John, a 60-year-old man, went to his GP and revealed that he noticed some rather odd changes to his body. At first, it was a slight tremor in one hand. Wasn't much of a problem, he thought to himself. Probably just one too many late-night cups of coffee from a stressful project recently. Subsequently, he noticed that he started to have difficulty walking, and his movements were slow, stiff, and uncoordinated. He was referred to a neurologist, and after a series of examinations, he was diagnosed with Parkinson's disease. Parkinson's disease is a neurological condition that affects movements. It is most commonly diagnosed in people aged 60 or above. The Parkinson's Association in Ireland states that Parkinson's disease has affected approximately 12,000 people in Ireland, and it is the second most common neurodegenerative condition after Alzheimer's. In order to understand Parkinson's disease, we need to understand how our normal movement is performed. Let's take a simple action, such as grabbing a slice of cake, and also consider the ability not to grab the slice of cake, maybe because you're on a diet. When there is a desire to carry out voluntary movements, let's say when you want to eat the last slice of cake, the thought of grabbing it begins in the cerebral cortex. This tells the basal ganglia, which is the voluntary movement control center, to grab the cake. The cerebral cortex is like an excited child who wants to eat cake, while the basal ganglia is the parent supervisor, deciding if it is a good idea. The basal ganglia effectively acts as a filter, so that we don't have exaggerated, excessive, and unwanted movements. Inside the basal ganglia, there is an on switch, a direct pathway, and an off switch, an indirect pathway. The on switch facilitates movement, while the off switch prevents movement. Both on and off switches will be stimulated at the same time because your cerebral cortex is connected to both of them, and they cancel each other out. The thought of eating the cake occurred, but because both switches cancel each other out, no final signal is generated to initiate the action of eating the cake. That is how one might resist eating junk food, or so I'm told. I've never actually done so. In order to actually perform the action of eating the cake, another part of your voluntary movement control center comes into play, the substantia nigra that releases dopamine. It stimulates the on switch and inhibits the off switch. The on switch will now allow you to eat that last slice of cake. The fuel for movement, dopamine, is the chemical that John and other people with Parkinson's disease lack because there is an underlying damage to the substantia nigra, which produces dopamine. Without dopamine, the off switch remains overactive, which makes it hard for patients to move their bodies because their muscles are not stimulated enough. With this in mind, we can now understand why John finds it difficult to carry out any form of wanted movement. Symptoms are mostly related to movement, as seen in John's case. First, he has resting tremors, or tremors that happen when you're not moving, notably in the upper and lower limbs. Stiffness occurs, and, in its extreme, rigidity of the muscles of the face can cause a loss of facial expression. Painful muscle cramps can also occur. Slowness of movement makes everyday physical actions, like walking, harder for those with Parkinson's. Accessory symptoms include balancing problems, burning, numbness, and chilling sensation, and even those not movement related, like low blood pressure, loss of smell, bladder and bowel problems, anxiety, behavioral changes, loss of memory, and sleep difficulties. In summary, Parkinson's disease is a neurological disorder that causes difficulty in movements. It is due to damage to the part of your brain that secretes dopamine, which is essential in initiating movement.